video here about the final coming up here. Basically, I think what we'll do is we'll just go do a quick walkthrough of the 6 blueprints. I'll preface this with you should approach all of these questions and information from a nurse's perspective, and you've been a student long enough to where most of you are starting to think like nurses, and it's reflected in your exam scores. So from a nurse's perspective, you should be thinking about assessment, think about signs and symptoms, lab values, trends in lab values and other diagnostic tools, assessment of medical data, vital signs, and then you should be thinking this all ADPI diagnosis. What's your primary focus? A client may have several diagnoses, but which is the highest priority? I like to say, what's going to kill the patient first, or a change of condition. What does the provider need to be notified about? Once you've assessed and diagnosed, you need to come up with a plan for your client, and when you come up with a plan, think about the next step, the interventions. Think about nursing interventions. We as nurses can do a lot to help the patient. It doesn't always have to be given a medication or performing a function like an EKG. You need to think about the simpler things such as raising an extremity to decrease the edema, things like that. Always think about safety as well. And then lastly, after interventions, you want to evaluate. So once you do an intervention, you raise that extremity up because it had edema, you want to evaluate. Look at the data. Did the edema decrease? You use that data to make an evaluation. And the reason you evaluate is because you need to know whether or not that intervention works so that you can modify it or maybe change it. Maybe you would raise the extremity with 2 pillows instead of 1 if it didn't have the right outcome for you. Or maybe you could stop the intervention. If the intervention created a problem, stop the intervention. Or maybe you just need to change the intervention altogether, and instead of raising the extremity, maybe you can look for another intervention, such as get an order from the doctor. But you want to make sure that you don't give your practice away. And there are nursing interventions that enable you to do a lot of things to help a patient. So don't give your practice away to delegate it out to a tech or a doctor for that matter, because as nurses, we can do a lot to help patients. Test taking tips. Review all medications, review why they're used, what their function is, how they work, and the side effects. Side effects are often important. Think about Lasix. Given Lasix, you think about potassium, but most all medications have side effects, and you need to be aware of what they are so that you can recognize them, so no harm comes to your patient. It's very important to understand lab values. In this first module, cardiac module, you're looking at troponin and things like that as important lab values. When addressing questions, remember each available answer may reflect an action the nurse can take, but the goal is to select the answer that is most appropriate for the issue addressed in the question. And most of you have adapted to this, adjusted to this, and now you pay more attention to the questions themselves. But the question may ask for an intervention, and 3 out of those 4 possible answers may not be an intervention. It's evident that a lot of you have made this adjustment because your test taking skills have become much better. I mean, think about when you were a junior. less than a year ago, you're in the spring semester, and how you struggled with figuring out how to find the right answer versus where you are now. Talking about going through blueprint number 1, the cardiac module. They talk about the concepts here, blood studies, cardiovascular testing like EKGs, troponins, labs, hemodynamic monitoring, dysrhythmias, arrhythmias, the different rhythms, AFib, aflutter, those things. Make sure you review those. Heart sounds, electrolytes, potassium's a real important one in the cardiac module. Cardiovascular studies, whether it be, in the cath lab or surgical procedures, angina, acute coronary syndrome, MIs, where MI would be a big portion of the cardiac module. How to recognize the signs and symptoms, how to treat it, what things are important, and even up to and after post the post cardiac infarction stage. Valve disorders. Think about mitral valve, and the signs and symptoms and treatments for that. Cardiomyopathy, pericarditis, myocarditis, heart failure. Signs and symptoms, heart failure, pink, frothy sputum, and the patient needing to have 2 pillows under their head, or wanting to, in order to breathe better, automatically points to heart failure and pulmonary edema. Vein disorders, hypertension, common meds with hypertension like lisinopril, beta blockers, metoprolol, how they work, what they do, what their side effects are. Cardiogenic shock, cabbage, pacemakers, cardiac diet, cardiac medications, beta blockers, ACE inhibitors, calcium channel blockers. Different medications are given for different reasons. Patient may be on 3 different kind of meds. They may be on a beta blocker. They may be on an ACE. They may be on a calcium channel blocker because 1 or 2 medications alone aren't doing the job that needs to be done. Blueprint, module number 2, blood disorders. When preparing for exam, use 6 functions for clinical judgment. Recognize the cues. What matters most? Analyze the clues. Do they have a fever? What does that mean? What could that be a sign and symptom of? Prioritize a hypothesis. Where do I start? General solutions. What can I do? As a nurse, there are things I can do. And when I exhaust those, then I need to go to a provider, another discipline. Take action. What am I going to do? And then evaluate. Now that I've done this, did it work or didn't it work? Should I make adjustments? Should I stop it? Should I increase it? Should I decrease it? Should I call the provider for something else? Things in the blood disorders module 2, types of anemia, sickle cell, leukemias, neutropenias. You need to know the signs and symptoms, the differences between them. Blood transfusions, probably one of the most scrutinized documentation that you'll run across is the blood transfusion paperwork or documentation. I can guarantee that somebody will be reviewing that. Thrombocytopenia, hemophilia, different types of hemophilia and the medications and treatments for that, or the precautions that are needed to take. Von Willebrand's, DIC, Hodgkin's and non-Hodgkin's lymphoma, multiple myeloma. We see a lot of that around here. Bone marrow aspiration and biopsy. Oncology medications. See the lecture notes about that. And then the back end of this had a little bit to do with some of the neurological disorders, multiple sclerosis, myasthenia gravis, ALS, Guillain-Barré's, muscular dystrophy. Know the difference, the common types, the signs and symptoms, how they differ, how they're the same, what type of populations that these diseases affect. And then module 3 gets a little deeper into the neuro dysfunctions, a little bit in the anatomy, Alzheimer's, who does this affect? What are the early signs and symptoms, late signs and symptoms, things of that nature? Parkinson's, how does dopamine cause this, affect this? How does it interact with, the Parkinson's diagnosis? Huntington's, does genetics play a role in these disorders? MRIs, is an MRI going to show that an Alzheimer's patient has some kind of dysfunction by an MRI? Doll's eye, how does that work? How do you tell a positive doll's eye? When do you use it? Is it for a conscious patient or an unconscious patient? Diabetes insipidus, why does it occur? What are the signs and symptoms? At SIADH, syndrome of inappropriate diuretic hormone, approaches to craniotomy. Headaches, different types, signs and symptoms, who gets them, medications for them. Strokes, ischemic versus hemorrhagic. With ischemic stroke, you may want a blood thinner. You definitely don't want one for a hemorrhagic stroke. Why? TIA, transischemic. Meningitis, there's bacterial, there's viral. Who gets them? What are the common treatments? What are the risks involved? How do they diagnose this? Oh, things like cancers of the brain, gliomas, meningiomas, um, complications, treatments, recurrence. Module 4, traumatic injuries, things that you a lot of times might see if you're an ER nurse. Remember to break down each concept, use an ADPI, primary versus secondary. Remember the labs and medications with therapeutic ranges for some of these. Open head injuries, closed head injuries, secondary brain trauma, ICP. And we'll talk a little bit about ICP in one of the other modules here. Lumbar punctures, diabetes insipidus, and SIADH talked about again. Post-brain injuries, things like seizures. What kind of medications do we use? Do we need to monitor lab values on those? What are the other complications that can arise from seizure meds? What kind of precautions do we take with patients that have a history or potential for seizures? Spinal cord lesions. Module 5, respiratory, everybody's favorite. Once again, think about ADPI, assessment, diagnosis, nursing diagnosis. What can you do? Sit the head of bed up for an action. Acid-base balance, your metabolic, your respiratory, acidosis, alkalosis. Check out if you have a hard time with these, as a lot of people do. Some people looking over their test, they've missed all of the ABG questions. You'll probably see this again. So if you're not good with it, check out Jennifer Hatley's video. That video is fantastic. It's short, to the point, and it makes ABG interpretation really easy. Discuss know the disease processes that relate to these acid-base imbalances. Think about DKA, think about asthma, respiratory diagnosis, reasons for diagnostic procedures, and the reasons for them, like things like bronchoscopy, thoracentesis. Why do we do them? What do they tell us? What kind of complications can arise from them? COPD and asthma, know the difference, signs and symptoms of each disease, how they differ, how they're the same. Endotubes and tracheostomies, assessment of each, trach care, think VAP, ET care. How do we take care of these things? How do we get these patients off of the vent? That's important. One of the biggest areas that I saw students struggle with is ARDS. Make sure you thoroughly um, look over the lecture notes on ARDS if you don't have it down. Many students missed a lot of the questions in that category. The labs, the complications, the signs and symptoms. And that's something, acute respiratory distress is something that you see a lot, both in the coming into the ED and in a med surg unit or anywhere else for that matter. And it's important to understand it because it can progress into the next thing, respiratory failure. Um, and these patients are in distress, they're labored, they get tired, and they stop breathing. And so it can be a big cause of death. ABG labs, um, causes and symptoms. What's a normal range for ABGs? Think about pH. What values are conducive to life? Which values are not conducive to life? Chest tube care, ventilator complications, bucking, and we talked about that. Barotrauma, we talked about that. And VAP, ventilator associated pneumonia. And there's big push in the hospital to prevent that. It's a big preventable problem. In our last module, module 6, think about kidney failure, acute versus chronic, labs, causes, treatments, differences, similarities. Renal transplant, who's a candidate, who's not. What do we do for rejection? What kind of medications do we see in renal transplant? Hemodialysis and peritoneal dialysis. What are the similarities? What are the differences? How do the diets differ? Um, Glomerular nephritis, chronic versus acute. Polycystic kidney disease. We talked just a little bit about that. Urinary diversion, um, which we see a lot. And then getting into disaster nursing, we touch on this in community, and touched on it a little bit in lecture. The triage, most of you have that down. Um, Primary, secondary, and tertiary prevention, which you've been exposed to here for the last almost 2 years. So you're getting better with that. Emergency planning and natural disasters. Something y'all missed, almost everybody missed on the exam were weapons of terror that are commonly used, such as biological weapons, anthrax, um, smallpox, nerve agents such and blood agents, sarin, cyanide, things like that. These are things that you need to know because it could happen. You might be exposed to these things, and it's important for you to know how to take care of yourself and take care of others should you be exposed to them. And lastly, burns. The Rule of Nines is big. I think y'all did well on the exam for that. Smoke inhalation. You didn't do so well on the questions with smoke inhalation. Um, one of the priorities with smoke inhalation is keeping an eye to make sure that we don't have to intubate because with that smoke inhalation, a lot of times they'll lose that airway. And if you lose the airway, it's a big problem in keeping them alive. Carbon monoxide, poisoning, contractures, and then wound care with burn patients. So what I would recommend for your final is plan your study time. Studies show that if you plan ahead, you write things down, get yourself a legal pad out or just a piece of paper, and plan ahead. Okay, you can study Monday, Wednesday, Friday, and you can study in the morning on one day, in the evening. Write it down. On Monday, I'm going to do Monday morning from 8 to 10, and then Monday afternoon from 3 to 5, and limit it to 2 or 3 hours at a time with breaks in between. Um, After 2 or 3 hours, most students, you kind of lose your ability to concentrate and the memory banks get full and you need to take a break, go outside, um, play around in the garden, go to Starbucks, get yourself a cup of coffee, go out and pet the dog, whatever you need to do to remove yourself from that thinking pattern. So you write down your study times, divide them up, divide your modules. You're going to need to touch on every module, but focus more on the ones you didn't do as well on. For a lot of you, cardiac module was the most difficult, or the one you didn't do as well on. Focus time on that. But at the same time, don't totally neglect any of the other modules. If you did well on the respiratory module, spend less time on respiratory, plan ahead to spend less time on respiratory than you would on a cardiac module. But it's important that you review all modules and plan that time. If you don't plan that time, what's going to happen is you're going to get to one module and you're going to spend all your time on that module and not get to the other ones. So I'd recommend you print out your blueprints. There's 6 of them. It only takes a few minutes to get them printed out. Then get your study materials and line them up with each blueprint so that you have them separated. Make your list of when you're going to study these, and stick to it. Once again, blueprints, maybe some lecture notes, gather your other study materials. If there are other things, videos you want to watch, write those down on a blank piece of paper so you don't forget to watch them or look at them, or charts or tables, things like that. So that you have a pile for each module. Once again, only study for 2 or 3 hours at a time. Break them up throughout the course of the day. And that's the best way to make sure you hit everything. That's what I have for preparation for your final. We will see you on Tuesday.